Hello, everyone. Welcome to the AMA Steps Forward webinar series. My name is Jill Jin. I am a senior physician advisor with the AMA Steps Forward program, and I'll be moderating today's session. Before we begin, I want to remind everyone that this session will be recorded and will be available after the event. You can use the audience link you joined with today for a replay and view later when we publish on the AMA YouTube channel. You can also download today's slides as well as additional resources that we reference in the additional resources widget on your console. Following today's presentation, there will be an open discussion where we can answer questions. So please submit them using the text box on your console and we'll get to as many as we can. So without further ado, I would like to introduce today's speaker, Dr. Jonathan Ripp. He is well known to many of us for his great work in burnout and well-being. Currently a professor of medicine, medical education, geriatrics, and palliative medicine, the Senior Associate Dean for Wellbeing and Resilience, and Chief Wellness Officer at the Icahn School of Medicine at Mount Sinai in New York. Welcome, Dr. Ripp. Thank you so much for joining us today. I will go ahead and hand our audience over to you now.
Thanks so much. Really great to be with you all, to be back at the AMA. I always appreciate and enjoy the opportunity to speak with you as part of all of your incredible efforts to advance clinician well-being. And excited to talk about a topic that is somewhat new in terms of some of the content that I typically share and present. And so today we'll be talking about the role of communications in promoting a culture of well-being, speaking to that. And I plan to speak for hopefully about 20 to 25 minutes and leave plenty of time for Q&A, which is always the most interesting for me. So please do, I know many of you already sent in questions, and please do feel free to add. I always enjoy participating in a healthy discussion. So with that, what I'd like to do is begin with sort of framing why this topic has become more pertinent in the wake of COVID's impact on health professionals and health professional well-being. No doubt a lot of what you'll see as these background slides will resonate or be some data that you perhaps have seen already. I then want to dive into recognizing the role of communications and what role it plays in promoting workforce well-being, and do so in the context of considering some specific wellness-centered communication skills, and then wrap up by identifying what the components of a well-being communication strategy might look like from an organizational standpoint. So if you represent an organization that is perhaps interested in thinking about how to organize and strategize around communications in a way that can promote well-being, I hope that component will resonate with you. So with that, this is perhaps a slide that many of you have seen. It's taken from data captured in 2021, published last year from the large AMA cohort, looking at burnout prevalence and the sort of striking increase that we saw from 2020 prior or just at the start of the pandemic, and then really right in the midst of the pandemic. So clearly we are dealing with the healthcare population that was already experiencing a lot of threats to well-being, and now some evidence suggesting that it was significantly impacted during the pandemic. And I think almost certainly it's coming down a bit now, but as I no doubt many of you are experiencing and are seeing in your communities, that we're still dealing with a lot of challenges and the wake of the pandemic as it relates to the well-being of the healthcare workforce. We know some further information captured from the AMA's Coping with COVID data set, which surveyed thousands of nurses, doctors, APPs. This was the data that was captured and then spoken about in the lay press as well. This piece from the New Yorker, but this piece here, which was in Mayo Clinic, showed the interest in reducing or leaving the workforce in the midst of COVID, and worse in nurses than doctors. And I think a lot of us have seen that in our institutions. And then importantly, what are the risk factors? So having burnout, which has pretty much always been associated with intention to leave, and intention to reduce work hours, was, of course, seen again in this data set gathered during COVID. Being in practice for many years, over 20, having anxiety about the pandemic, excessive workload, fear of exposure. So obviously a lot of risk factors related to the pandemic itself. But importantly, and one that I think relates to today's topic, is what is a buffer? What can be protected? And that is feeling valued by your supervisors, feeling valued by your institution, reduces the risk of these outcomes of wanting to reduce or leave your practice. And so I imagine this too is a figure that many of you have seen. I always put it up these days, or often put it up, I should say, at the start of talks to kind of remind ourselves what we've been through and where we are. And that at the start of the pandemic in 2020, there's sort of this idea of a honeymoon period where perhaps there was elevated mood related to feeling a closer connection to one's purpose in one's career and one's life, but then followed by this disillusionment phase afterwards. And I think it's fair to say that we may be in the sort of reconstruction phase beyond coming out of the pandemic. But certainly reeling in many ways, and almost certainly worse off than we were. And of course, there are events that occur along the way, whether it's an anniversary reaction or other stressors that creep in that might lead to a setback. So it's not just a straight recovery that we're going through. Related to communications and communications during a crisis period, this is a figure that captures sort of what our experience was and what we wrote about at Mount Sinai back in the heart of the pandemic in 2020, that during times of extreme stress, of crisis, there's sort of this curve that follows the extent of the pandemic. So if there's a pandemic wave, for example, and as the cases were going up in the beginning, especially in the very beginning, there was sort of the very basic needs. How am I going to get to work? How am I going to protect myself? How am I going to care for my family? And so what we observe is that and what it should inform the messaging is how one's basic needs are being addressed. But then when you're not sure, you're at this plateau, you're not sure, is it getting worse or better? And arguably at other phases, there's a lot of uncertainty. And whether it's a pandemic or uncertainty about any other potential, driver in one's workspace, uncertainty drives anxiety. And so the ability to leverage communications to address that uncertainty can be really an important and supportive tool. And then afterwards, as what we saw again in the pandemic, as the cases came down, that was the time when people could take a breath, but also a time when people might start processing what they're going through. So potentially a potentially important period as well. So this is what we learned from the COVID experience. We also, again, just to point out this kind of on the right side of the screen, this sort of modified hierarchy of needs, where again, you can't really talk about achieving respect, appreciation, and healing patients if your basic needs and safety are not taken care of. And it certainly is pertinent to periods of time and crises. But it also, I think, reflects periods, other periods. Obviously, a lot of us are talking about workplace violence right now that we've been seeing increasingly. And so, how safe does the healthcare workforce feel working day to day, even though we're coming out of a crisis period? It's critically important and has to be addressed first before you can start talking about these other elements. In our paper that we looked at trying to understand and address sources of anxiety, again, some lessons learned that inform communications, some lessons learned during the pandemic, people told us what they needed and what their sources of anxiety were and what their request was. And, certainly was to be heard, protected, prepared, and supported. But in the end, it was about being cared for. And I think that extends beyond pandemic and crisis periods. It extends, that's the base of what I believe a well-being communication strategy for an organization needs to deliver. That's the message that needs to be delivered. We at Mount Sinai adopt this mission and model where it's our goal, our mission to promote the well-being and satisfaction of the workforce, and to do so by advancing a culture that enables our workforce to do its best work in a community where folks feel valued, right? So there's that feeling cared for, feeling valued. It was protective during COVID, and it's really where most of us involved in well-being work are putting our focus. We're focusing on those large system-level drivers, the culture and efficiency efforts. And so where does communications fit into a model such as this one? Again, if you're thinking about creating a strategy at the organizational level to address well-being, it's really, in my view, it's the culture piece, that if you can enhance the well-being of, if you can enhance communications, you can help promote a culture of well-being. So with that, I want to move now a bit to talking about, how you do that and what do we mean by well-being communications. And certainly well-being communications are not just words. Words do matter. The words we use to inform our communications do matter, but it's also got to be a little more than that. And this video here, very briefly, I think captures that.
Attention! Happy Doctor's Day. Please proceed to the 6th floor atrium to receive your Doctor's Day gift. Hi, I'm here for my Doctor's Day gift. Okay, great. What's your name? It's Bill. And what's your last name, Bill? Bill. Your last name's Bill? Yeah, it's Bill. Okay, Dr. Bill. Here's your ticket. Step over to the next table and a hospital administrator will give you your gift. Hi. Ticket? Here you go. Okay, great. Thank you. You're welcome. And back to work. Wait, that's it? Happy Doctor's Day. Now, please move aside. We need to keep the line moving. Can I get another thank you? I'm sorry. It wouldn't be fair to other people that only got one thank you.
All right. Hopefully that was good for a chuckle the first time around. And the point I was just trying to convey there through our friend there was that, words do matter, and they can be very helpful in conveying thanks, but they're not sufficient. And I think all of us want to be thanked. We want to be appreciated. It's an important, it's a necessary component of a culture of well-being, but really words should be accompanied by actions. And many of you may be familiar with this AMA Steps Forward module, the Listen, Sort, Empower that Steve Swenson authored, which talks about not only communicating and delivering words, but listening to words and listening to what the needs are that come from the communications that you have, and then sorting those and empowering those who you're listening to actually engage and complete the deliverables that they're asking for. So creating a system where you enable folks to actually not only be heard, but also a space where their needs can be listened to and then acted upon. And this model, which is called Listen, Sort, Empower, also talks about how to, when you start to listen to people and you start to hear what their needs are, and you start to empower them, you're not going to be able to deliver on what everyone wants. But almost certainly, if you come up with a laundry list of about a dozen things, say that are needs that are expressed, you can organize them in this sort of impact feasibility square. And so there will be some that have low impact and low feasibility, and those you just won't be able to do. You can't get those done. But there'll be some that are highly feasible and highly impactful. That's your priority one. Those are the things you want to do right away. And there'll be things that are maybe highly feasible and have low impact, but you probably want to try to get those done too. And the point being is that you're not just thanking people, you're listening, you're sorting what can be done, and you're empowering action. And then you can communicate back and say, we heard you, and here's what was done about what the needs were that you expressed. And a good communication strategy will also manage expectations. You have to figure out how to communicate that you're not going to be able to do everything that everyone wants, but if you're effective in getting some of those things done, that can deliver that important message of that you care. So it's not just words, it's the actions. And certainly this has been exemplified in a number of pieces about small actions that can deliver a big message. Certainly, we're all all of us who are involved with the inbox, the electronic health record inbox, have been inundated with messages. And there are models where you can get rid of the stupid stuff. I'm sure some of you are familiar with that. Ways to just eliminate small things that are getting in the way, that are sort of those daily annoyances, that it takes multiple clicks to get certain things done when you're ordering in the computer, or messages that maybe never need to come to you in the first place. And there's lots of good resources that exemplify this. Certainly the AMA Steps Forwards, electronic health record efficiency strategies point out a lot of these things. A lot of it focuses on better utilization of the team. So figuring out how to use electronic health record strategies to divert messages away from just going to one member of the team, but better utilizing the team. But some of this is just about simple things that you can do that eliminate and save time during the day. And so it's not about solving every large problem all at once, but being able to listen to folks and then acting on their small requests. So words do matter when you're developing a communication strategy. And I say that because all of these terms you see here on the slide are sometimes used interchangeably, and that can create confusion. So it's pretty important to sort of adopt a terminology and define what you mean by it. We typically use well-being because when we talk about the well-being of the workforce, we feel that it really focuses in on the system level drivers. And so it's not about the individual. It's not about the individual getting themselves well or becoming more resilient, all of which are useful. And there are lots of resources that can enable individuals to become more resilient and withstand some of the system stressors. But really, when the focus is on the system, it's important to use terminology that you define and highlights that, so that we're all speaking the same language when we're communicating. And so when you're developing a well-being communication strategy, it's really about marketing in many ways. There's a lot of great work that's going on to promote the well-being of the healthcare workforce at most institutions. And so but I don't think that information is necessarily delivered to the workforce at most institutions. And so you actually, if you're engaged in trying to show people what's being done to support them, then it's important that you communicate that and that you market that and that you're effective in your reach. And so if the output of external marketing is to promote interest in a product, then the output of an internal marketing campaign is to promote engagement and well-being. Whether it's a crisis period or not, again, the message is a simple one: we care. So that should be the mechanism. That should be the output of a well-being communication strategy, that you're able to show through actions and words that you care about the workforce, thereby enhancing the culture of well-being. And so how do you do this? Well, there's been a number of models proposed. This is the wellness-centered leadership model from Shanafelt. Again, at the bottom there, you can see the foundation is to care about people always. So when leaders are leading using wellness-centered leadership, again, the basis is that they communicate a message that they care. So it's really central. And so what is the goal or the purpose of a well-being communication strategy? It's to address informational needs. Again, remember that uncertainty can drive anxiety. And so understanding where that uncertainty is, where the need for information is, can really help to alleviate anxiety. It's to deliver informative messaging that reaches the intended audience. That's the key piece, right? That's your marketing strategy. You can have a beautifully crafted message, but if it doesn't get to folks, then it's not useful. Provide content related to support. You want to show people that you care about them and that there are supports there for them, and use a tone that engenders a sense of caring. This is where I think a lot of internal communications go wrong, is around the tone, which can be hard to fix. But here's a couple of sample tactics related to each of those elements of a communication strategy. So how do you enhance reach? Well, ask people how they want to be contacted. You can do this through surveys, through focus groups. How do you deliver the right content? Well, identify champions across your communities who can help capture what the information needs are, identify what the uncertainty is so you can deliver that information or help deliver that information. And then to modulate the tone, maybe form a group that's really good at this, that's good at understanding how messages land. So just diving a little bit deeper into each of those before we wrap up. So when you're talking about enhancing your reach, time is precious, as we all know. So really streamlining and simplifying requests for feedback can be super important. How does this work? So if you're trying to understand from folks what their information needs are, you can ask a 2-question survey. What resource were you looking for on the website? Mental health, peer support, coaching, spiritual, etc. And then, how long did it take you to find what you were looking for? Was it quick? Did it take a long time? So this can give you valuable information about whether people are actually aware of resources or which resources, and how easy was it for them to find it. So you can gather this information through super quick surveys. What about tone? Well, here's a great example, not too far from a real message that went out. Dear staff, a recent audit has brought to your attention that there is wide variability in the time between patient visits and the completion and closure of documentation. Timely closure is an issue of quality of care and compliance with billing. We have recently instituted a new policy. All charts must be closed within 24 hours of patients being seen. The full policy can be found in the policy handbook. We thank you for your understanding of this important new requirement. So the point here is that well-being communications and a communication strategy, it's not just about sending messages that are messages of support. It's about infusing all messaging with a tone that is thoughtful to the way in which it's going to land. And so this may be a necessary message. This may be a requirement and all of us have requirements that we need to meet, but the way in which that requirement and the message is the tone of that message is crafted can really make a big difference in terms of how people feel cared or not cared for. So just trying to bring this home and summarize, COVID really obviously has had a significant impact on the well-being of the healthcare workforce. We know this, but we also learned some important lessons around the value of communications during that time. And that specifically when uncertainty is driving anxiety, communications can be very helpful. Whether it's a pandemic situation or not, communications can address those informational needs. Coming up with a strategy that has tactics such as those that I described are really essential for an organization. And they ultimately, again, remember the goal here is to deliver a message that we care. I think there's a lot going on at a lot of institutions that can help with that message, and actions and words are necessary to do that, right? You can't just say thank you for what you've done. You've got to really engage in bi-directional communication. You've got to listen, and you've got to create mechanisms where if you can't act on all the requests and needs, you can identify those, you can listen, sort, and empower. You can identify those that you can act on. And then the critical, that last step, the last mile is circling back and saying, we heard you, your needs were clear, and we were able to address some of them, and here's how. And so that really is a critical piece to communicate effectively. Lastly, the communication strategy should include a focus on reach, content, and tone. So with that, I really, again, appreciate the opportunity, and I'll turn it back to you, Jill, to handle any questions to moderate.
Great. Thank you so much, Dr. Ripp. That was fascinating, and so many key points, so much to digest there. So for the audience members, please, for the Q&A, put any questions directly in the Q&A box on your console. In the meantime, we did get many pre-questions that were submitted at the time of registration. So while we're collecting some of the live questions, maybe I will take a moment to ask you some of the pre-questions that came in. So I was thinking so there were a few questions about what I'm going to call communication fatigue among team members and physicians, in particular email fatigue, but also other forms of communication with physicians, because as you're aware, and as we're all aware, there are so many ways to get a hold of physicians these days. So whether it's email, text paging, cell phone, regular phone, Teams messaging, Epic messaging, Epic chat. It seems like there are these communication channels are meant to make it easier to reach physicians, but also it also leads to less efficient communication. So there are a few questions and concerns that came in about that. Yeah. And it also leads to redundancy in communication. So I, along with others, were curious about, do you, from your leadership perspective and experience, have any best practices for addressing all these communication channels?
Yeah, it's a real challenge. I mean, I think your question relates directly to the idea of creating a well-being communication strategy from the standpoint of how do you reach a workforce that is being overreached, so to speak, that is being contacted in so many different ways. And so there's two issues here. One is the operational challenge that we face around there being just too many ways in which we can be contacted. And so I think internally we owe it to ourselves to create some hygiene, for lack of a better word, around that, to sort of decide to come up with standards upon which we will or will not be reached. And increasingly you're seeing this happening. For example, you'll see people, and there's some strategies that we employ at Mount Sinai where we suggest, for example, that if it's not an urgent message, it doesn't need to be sent outside of work hours. So one strategy you can take is limiting the time during which messages are sent. The other strategy is, people have put at the bottom of their emails, I don't feel compelled to respond to me outside of work hours, right? So part of this is establishing a standard that kind of addresses some of that over communication. I think as it relates to a well-being communication strategy, it gets to my point about one necessary component is how do you reach people, right? So if you think you're going to reach the entire workforce by sending a beautifully crafted email, think again, right? So you need to, as part of your internal marketing strategy that delivers a message that says we care, you got to think about how are you going to get to folks. And so that involves asking people, what is your preferred, means by which we communicate with you. So that's that kind of bi-directional component. The last comment I'll say is, I think up until now, those people who use best practices, limit the times that they send emails, or suggest that they don't need to be reached out of outside of normal hours. That's kind of all left up to the individual groups to decide how they want to do it. I think we need to push the culture further so that it becomes standard practice, right? And that means creating operational policies at the system level. Some systems are doing that, but it needs to happen in both domains.
Excellent, thank you. All right, so a few more questions have come in. One is about, what are some of your go-to resources on these topics?
On topic of communication specifically?
Yes, external resources or training or marketing, you talked about the marketing strategy. Are there any resources in particular? Yeah. Well,
certainly, I included some of those in the talk, and a lot of them come from AMA Steps Forward. So, I think, let me just see if I can, there was, so some of, this, I don't know if you can see this slide here, 16, it's not advancing for me here, I'll go this way. So these are steps forward. They talk about efficiency that's different than communications, but this one, the listen, sort, empower, I think is the way to communicate with action, not words. So I definitely encourage folks to go there. And, then what I would say is, I'm not a communication specialist. I'm not trained as a communication specialist. So this has to be a partnership with, if you're at an organization, this has to be a partnership with your marketing and communications colleagues. who are expert in that. So whereas I think there may be some resources that speak to, how to engage, in actions, well-being related actions that are going to convey that message that we care and show that you're listening to people. When it comes to, sort of how do you integrate with the platforms that actually can deliver your message, it's got to be a partnership. At the institutional level, it's got to be a partnership with marketing colleagues.
I think that is a key point. Thank you. Another question from the audience. What are some ways to create bi-directional opportunities, more specifically real-time feedback about communication sent to frontline physicians?
It's a great question. And it dovetails in the sense of, on the one hand, we want that kind of real time. We want to be able to say, like, here's what's not working, here's what I need to know, and have that bi-directional, the workforce needs to be able to say that to the folks that then can communicate back with them, right? So on the one hand, there's that need for real-time communication. On the other hand, here we are talking about trying to diminish the many different ways in which we're communicating, and that could be yet another way in which people are receiving messages. But all that being said, is I think there's lots of great tools that can be used. There are text-based tools that can be used to send very brief surveys. I think there's many ways to do this. It doesn't have to be fancy. For me, the point that I was making there is having your kind of boots on the ground, so to speak. So having, for us, it's our well-being leaders, are the champions that are embedded across the institution, who can are closer and have their ears to the ground and can then communicate back with the well-being leader. And so having those folks that are kind of embedded is one way. So having your point persons, but also there are great tools that you can use, text-based tools that can send very brief surveys out to a large number of people. And as long as with any platform, if people are engaging with it, then it's useful, right? If it's messages that are going out that are not being answered, then it's not useful. So really my answer to that question is identify the tool that actually people engage with. There are many, and create the structure that enables that. And then, of course, when the key piece around bidirectional communication, a lot of times, leaders will hear from the workforce and actually act on it, but they forget that last piece of communicating back and saying, we heard you and here's what we've done, which, is it's sometimes forgotten, but it's the critical piece for both sides, because then the workforce feels cared for, and they see the output of their requests.
Yep. Yeah. Excellent. Yeah, it is a balance between the over communication and letting people know you've heard them versus the feeling like you're being too bothersome and too intrusive with the communication. So yeah, that's a great question. On that note, there was a question about, you talked about the underlying message always being we care, but how do you make sure that that doesn't turn into a sort of quote unquote toxic positivity? Maintain a tone of being genuine and authentic.
Yeah, well, I think that is another really great question, because it's easy to get this message wrong. So if you're communicating with a component of the workforce and that unit, that work environment is short-staffed, is maybe feeling like they don't have the resources to do their work. Maybe they're feeling like they're not being compensated the way they should be, or they see peers at other institutions being compensated differently. If you come in and say, hey, we care about you, and you don't address those issues, that's gonna at best fall flat and at worst backfire. So I would not advocate. There's a difference between creating a well-being communication strategy, the goal of which is to deliver a message we care, and toxic positivity and just sort of appreciation that doesn't have something behind it, right? So I would avoid any of that. It's really about knowing your audience, and so if your audience has real significant efficiency, operational concerns, and real issues, then the best way to say we care is by saying, tell me about, what your challenges are, and, I'll see what I can do to address them and fix them. That delivers the message we care, which is very different than saying we care about you. Because if you say we care about you and you don't address the things that are really negatively impacting one's work experience, then it's gonna fall flat, it's gonna backfire, it's not gonna be useful.
Exactly, like in the video.
Right.
Okay, so then there was a question about where can we find some additional examples. I can kind of answer part of that. There is our new playbook called Wellness Centered Leadership that was recently published by AMA Steps Forward. And you, Dr. Ripp, created a table within that playbook that has all of these components that you just talked about, and then specific examples of kind of what works. For example, in that that tone example where you had about the coding, there was an example of a bad example and a better example in there. Mm-hmm. So that is one place in that table within the Wellness Centered Leadership Playbook that has some specific examples. Anything else that you could suggest?
Yeah, I mean, from my perspective, this is new territory. So, I think the idea of crafting this kind of work and thinking about how communication specifically plays a role is just at its infancy. So the resources you mentioned and that are in here, in combination with really identifying working with a communications expert, is the best way I could answer that question. I think we have more work to do to create resources.
Absolutely. And then I also wanted to touch on, if there were, your presentation today, of course, was focused from the leadership level, the communication strategy from the top down for this overall culture of wellness. In the pre-questions that were submitted, there were several questions that also came in about how to communicate from the bottom up. So, as a practicing physician, how do you communicate with leadership to advocate for yourself and to effectively communicate to kind of get changes made, or to create actions that affect change? I know it's a little bit outside the scope of this particular presentation of yours, but do you have any personal experience or any comments on that front?
Sure. Yeah. No, I'm happy to speak to that. And I think I would frame it again in the context of the model that we talked about, where we discussed that it's actions and words. So the words that are received are important, particularly as I mentioned, the tone can make a difference. But in the end, for an individual member of a healthcare workforce who wants to make their needs known, and so that they can be heard and acted upon and then communicated back about what was done. It's really about, I think ultimately it's about engaging in collaborative communication and collaborative partnership. And so that's why I like the listen, sort, empower model. It's really got to be enabled by the leaders. The leaders have to create the space for the individual to be heard. And then it's just about, sort of a lot of the things that perhaps many of you know in terms of, nonviolent communication and ways in which, you're coming not just with the problem, but with the solution. So I think leaders who enable the individuals to be part of the solution, create the necessary space for that individual to then communicate in a way where, to answer your question, you're not just bringing another problem, you're bringing possible solutions. And I firmly believe that it's the doctors, the nurses, the folks who are engaged in the work that have the answers. And so I think, and my personal experience is that has always been much better received and has led to change and has led to action. And so, in some senses, it's kindergarten stuff. It's, well, don't come and just, say you're not, you don't care, you're not doing anything, look at all these problems, why don't you fix them? It's about sort of saying, okay, I see this problem, I want to be part of the solution, here's what I suggest. It sounds easier than it is, and it's going to depend on a host of factors, where your organization is at in terms, or where your workspace is at in terms of wanting to participate in bi-directional communication. But if the opportunity is there for you, then it's about, engaging in being part of the answer, in addition to bringing making awareness about the challenges that are there.
Yeah, I think that's a great point. No, you're right. It sounds a little elementary, but I think for a burnt out physician, sometimes they forget that, you have to present a solution along with the problem. So I think that's a great point. Okay, so one final question from the audience was about suggestions for communications to address work outside of work reduction.
Yeah, that's a great question. The way I would think about it is that is one more one sort of informational need, or one domain that is obviously driving a very large deal of distress. And that's why I made specific mention to some of the AMA Steps Forward EHR recommendations, because we all know that's driving a lot of the burden that many of us are experiencing right now. So when I think about how to communicate about that, it's just one more area to communicate, to try to communicate effectively, to try to employ your strategy. So actually, right now at my own institution, there's a lot of efforts underway to address the in-basket, to address work after work, documentation. So there's real efforts underway. We actually, we can do more to communicate that. But for me, that's the content. That's the content to deliver. And then you got to go back to your strategy. What's the, how am I going to reach people with this content, right? And is this the what specifically do they want to know about? And then, what's the tone that I deliver it in? So to me, that's just a content area that addresses a source of distress that needs to be plugged into your strategy, and you can use your tools to figure out how to deliver the information. So I hope that answers the question.
Perfect. All right, so we are just about at the 45-minute mark, so we'll go ahead and wrap up. Thank you again so much, Dr. Ripp, for that great presentation, all your expertise in this kind of new area of focus and of research. And that was very useful and very helpful to all of us. We'll just take a moment to say a few final notes. So you may have noticed a survey widget on your console. Please take a moment to answer the questions there. Your responses will help guide our upcoming programming for webinars. You can also register for the next webinars in our Steps Forward series by following the link on your console. And then finally, I want to take one moment to speak about the AMA Recovery Plan for America's Physicians. This is a roadmap to ensure the country's physicians' needs are met so patients can receive the high-quality care that they deserve. Please visit ama-assn.org/recovery to learn how the AMA is leading the change to fix prior authorization, reform Medicare payment, fight scope creep, support telehealth, and reduce physician burnout. Thank you all again for joining us, and we hope to see you again soon.